Ladies and gentlemen, good morning. We are here today with our beautiful patient from the south of France. How are you?
I'm good, thank you.
Can you tell us how old are you?
I'm 29 years old.
She is 29 years old, and as you can see, she is coming to us to improve the shape and the volume of her buttocks area. Now, the first thing we have to do when we have such a patient is a proper examination of the anatomy. As you can see, we don't have to stop only on the buttocks area, but you have to check also the shoulders, the back. Can you just relax your arm? So, when the patient is relaxed, we can see there is a slight difference between the height of the two shoulders. It's normal, all of us, we have a kind of scoliosis. So, seeing that, automatically we can see that there is an asymmetry also on the two different sides of the buttocks. In this case, we need to feel the hip dips area, so we do a hip dips correction, and at the same time, considering that she has a good skin texture, when we will add the filler to give some volume, we will have a slight improvement and lifting of the buttocks itself. So we are going to work on the lateral area of the buttocks to correct the hip dips, and we will work on the upper third of the buttocks in order to correct this C deformity where most probably the fat just slide down due to the aging process. So now we're going to have a closer look to the patient's anatomy in order to mark the area where she needs the filler. First of all, let's see also the skin quality. Can you please squeeze your muscles? We will see that when she's contracting the muscle, there are few irregularities on the skin. Relax, thank you. This will be improved a lot after the injection of the filler because the hyaluronic acid recalls water and improves the skin quality itself. So let's mark the area. Let's see which are the limits of the buttocks. From the lower part, can you squeeze it please? We see this crease here on the lower buttocks area, which is marking the lower edge of the butt. I touch the bone, the spine, and I mark a nice curve here going till the iliac crest. This is the buttocks area that we have to treat. We have the muscle here, the gluteus major, and here the gluteus medius, and the gluteus minimus is behind this muscle on the back side. So we can divide basically the buttocks in three main areas, which are the upper third, 1, the middle third, 2, and the lower third, 3. Whenever we have a bit of laxity, we should avoid to inject the lower third, because when we inject the filler, we are adding weight, so automatically we are pulling this one down and giving a longer look, a longer shape to the buttocks. In this case today, I check the patient also from the front view, and this is the area that we have to correct. We don't inject where is the volume, we inject where is the lack of volume. And if you follow the line from the back side, you see that the shape, when we correct the hip dips, it's almost similar to a bean. And we mark the middle line because when we do the injection, these are our focus area where we inject. Personally, I like to use as an entry point the culotte de cheval, so the lower third of the buttocks. Why? Because here we have a nice representation of the fat tissue, so it's going to be very, very easy to find the right plane and do the proper injection. Keep in mind that not always one session is going to be enough to fill completely this area. Why? Because if here I can pinch a nice area, a nice quantity of skin, same here, so if I have to give volume, I have plenty of area to inject. When I have to do the hip dips correction and I try to pinch the trochanteric region, I see that there is no much pinching. Why? Because here in this area, the fat tissue is less represented compared to the rest of the buttocks. In this case, I'm going to use this entry point in order to use a cannula, which allows me to inject here, 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 and here. This is a patient that she might need around 10 syringes in total, 5 each side. Don't forget that the maximum amount of syringes which the company recommended for the injection is 14 in total. So 7 each side, or anyway 14 in total to balance and to fill the gap that she has. So we finished the drawings on this area. Of course, the best solution is when we start the syringe. If I'm planning now to inject fine syringe in this part, usually I inject 2-3 syringes, then I ask the patient to step up and stand up again. And I do again the drawings to check if there is more, if she needs more filler in one side, in one area instead of the other one. Now we did the right side, we can go to the left side. I don't have to remark the 3 area because I know already, and you can see now the perfect shape of that bean I was talking before, which is following exactly the lack of tissue and the depression that she has. We mark a middle line of the depression, because when we do the injection, we have to pay attention that we don't inject too much close to the edge. Why? Because if I inject closer to the upper edge, I get this. So the depression is showing more. If I inject too much closer to the lower edge, I get this. So the depression is showing more. The goal is with the first syringe to create a scaffold in order to lift this skin, and then we go, of course, in this case on the deep fat layer, and then we inject small bolus, or anyway we will see feeling under our fingers, our hands. We inject small bolus in order to lift the skin. Again, because she has a tight skin and quite firm, she might need 2 sessions in order to reach the perfect result. So guys, we are going to talk now about the 2 different products for the body filler. We have the MLF2 and the MLF1. Both are amazing hyaluronic acid products. Both contain 1 syringe of 10 ml each. The main difference is, of course, on the molecular weight, on the size of the particles. The MLF1 is used usually for the calls correction, for the intimate area, or for the correction of the small concavities, and also for the hands rejuvenation, which makes this filler a bit more soft, a bit more smaller in terms of particle. We are talking about 200 to 250, 300 microdalton. When we talk about the MLF2 is the thicker filler used to give volume to the buttocks area. It can be injected on both deep fat layer and superficial fat layer, and the size particle is from between 300 and 450 microdalton. Now, both fillers are amazing and both can be combined. I often use, when I do buttocks augmentation, the MLF2 on the deep fat layer and the MLF1 on the superficial fat layer. Why? Because in this way, I'm not only giving volume and establish the loss of volume that the patient had, but when I put a bit more superficial, the MLF1, being hyaluronic acid, the hyaluronic acid recalls water, which gives moisturized effect to the skin. So I really improve in the long term the skin texture and the skin quality. The MLF2 has to be injected with an 18 gauge cannula and 10 cm long, because allow us to treat the whole area of the buttocks. Now, this cannula, whenever we talk about calves, can be used also with the MLF1. It's quite easy to inject and you don't need much strength. But when we talk about hands or small correction, we are going to use a 21 or 23 gauge cannula, which can be 7 cm or 5 cm. For the hands, usually 21 gauge, 7 cm is enough, because from 1 entry point we can treat the whole hands. So now the patient is laying down on the treatment bed. I like always to make her laying down on her tummy and put a small towel under the area that I want to treat, in order to have all the full view of the area, and also, sorry if I do that, to relax the area. So in this way, for me, it will be much easier to find the right plane. Now, I want to spend a few words about the importance of being in a sterile, or as much sterile as possible, environment. Because one of the first complications that can happen whenever you do any kind of filler is the infection. But if we avoid that since the beginning, we can be sure that we don't have this kind of problem. So it's very important to isolate the area with a sterile drape after the disinfection. As a disinfectant, I like to use the chlorhexidine because it's not staining the skin and it's a surgical disinfectant. And after that, we can start the injection of the local anesthesia and start the procedure of the filler injection. Okay, we're ready to infiltrate the local anesthesia. I'm starting the injection of local anesthesia, okay? So I do local anesthesia on the entry point only. I use usually 0.3, 0.4 in total of lidocaine, plain lidocaine with a 30 gauge needle. We always inform the patient I'm doing the local anesthesia, okay? So now, because there is the black, I will do the injection just a bit further than the cross we did. So 1, 2, 3, zig, okay. And the goal of this anesthesia is to create, and I don't know if you can focus and you can see, a superficial bubble. Can you see? Now, why this is important? Because in this way I'm doing already an hydrodissection. So when I'm going to do now the entry point with my needle, I'm sure I am the right plane. And I will show you the difference of the planes when we use the cannula. Entry point. This is my personal technique. I go exactly perpendicular on the area where I did the injection of anesthesia, and I just push. I push till I feel a small click under my fingers. That click means that I went through the dermis. There is no blood. I always check if there are superficial veins. I remove it. In total, I would say it went in around 3-4 millimeters. So once we take our syringe out of the box, in this case MLF2 from Hyacorp MLF2 from Bioscience, we just slip it off the aluminum foil and we find in a sterile environment our syringe containing 10 ml of hyaluronic acid. I give this one to my beautiful assistant, thank you very much. I take my 18 gauge cannula 10 centimeter long. We remove the lid of the syringe. We just screw in the cannula, removing the lid, and we always prime the cannula. Now, these cannulas are quite good because you can see here, please zoom in, there is an arrow at the base of the cannula, which is indicating exactly the exit point, the way how the filler is coming out, which way the filler is coming out. And this cannula has 10 tags, which are indicating the centimeter of the cannula. So each tag is 1 centimeter, and when we reach 5 centimeters, we have 2 tags. So we know exactly where we are with our cannula. Now we did the entry point, there is no major bleeding, it's normal to find a few drops of blood. We clean the cannula, this is a sterile gauze with the disinfectant, and we go perpendicular. Now, if we want to go on the superficial fat tissue, this is the right layer. We can see that pushing down with the cannula, the skin is pulled down itself, means we are pushing on the superficial fascia, which is pulling the skin down due to the fibrotic septum. If, like in this case, I want to inject in a deeper layer, so in the deep adipose tissue, I pinch the area, I do a slight pressure with my cannula without forcing. Tell me if you feel any pain. I went through the superficial fascia, now I'm deep. And you see that when I bounce my cannula, there is no tissue recalling, no skin recalling, so it's flat. Do you feel anything? Just some annoying movement, maybe, but not pain. Okay. Doing that, I will tilt slightly my cannula. I like to do a slight massage in the area and going through the deep fat layer. Tell me if you feel pain. Why I ask the patient to tell me if she feels pain? Because the patient feels pain if I'm superficial and I'm touching the dermis, if I'm touching the muscles, or if there is a lot of fibrotic tissue and I'm breaking these fibers. I start from the lateral part, from the medial part, sorry. If I feel some obstacle, it's enough to just tilt the cannula or keep doing a constant pressure and do the massage here. I mean, I'm not superficial because I'm not pulling down the skin. The cannula is freely moving inside the fat tissue and I can start my injection. Are you ready? I always pinch the area I have to inject and I start with the first retrograde injection, going back and forth in order to create the scaffold which will give the support to the filler, to the other filler. As you can see, I'm not traumatizing the patient, I'm not stabbing the patient, and this is very important. She is relaxed. Are you? Sometimes she feels some pain. This is normal because we go through fibrotic septum. Just tell me, no worries, okay? And we finish the first syringe. Okay. Can I have the second one? Thank you. We keep doing the injection. When I inject, I feel the filler under my hand, under my finger. So I'm sure I'm injecting this in the correct area. Okay, can I have another gauze and the third syringe? We do some massage here. So I'm planning to inject 5 syringes each side, maybe 4. So after the third syringe, I will ask the patient to stand up and I can do the evaluation and in case correct my drawing. Okay, we just did 3 syringes. Okay, and I always like, and it's important for you as well, to ask the patient to stand up in order to see if there is a major difference or if there is any area that should be filled more than the other one. So after 3 syringes, this is the result, and I believe you can see there is already a huge difference. I inject in the right plane, I focalize my injection in the front area. So from the side and from the front, you see much less depression. Now the goal for me is to inject this area in order, sorry if I do that, to push this one out a bit. I don't want to go too much further on the front area because here we start entering the growing area where you have the lymph node. So we don't want to inject close to the lymph node, so we stick to this part. This is a natural, normal depression that the patient has because there is the bone of the iliac crest, the upper trochanteric region. But she doesn't have the gap that she had before, so the hip dips are already almost completely correct. Keep a gauze with the surgical disinfectant on the entry point. I like to do a massage, which sometimes the patient doesn't like too much. Okay. I check from the front, there is no bumping anymore. I check from the back side, sorry. Squeeze your muscles. Perfect, relax. Relax, relax. Another small massage here, and I see that my depression is still a bit in this area. Okay. And show me the front, please, the front. And a bit in this area, show to the camera. So now I will inject here and here. Very honestly, I think that 1 syringe can be enough, but the patient will ask for more. So we stick to our plan 5 + 5 in order to give also a below upper volume. I want to say one small note. This kind of injection would be the best to be done while the patient is in a standing position. I don't recommend to have a patient to do the injection in a standing position when you are starting using the product. It's a more advanced procedure, but of course it gives you the best three-dimensional view of the area that you are injecting, okay? So let's go back to the bed and we finish. So I did the 4th syringe, I did while she was standing up, I have to be honest. I believe you can already see the huge difference between the two sides. Now, to me, the hip tips is corrected here. What I want to do, because she is an amazing patient and she deserves, is to use the MLF1 all over this area in order to give still a bit of volume and to improve the skin texture. We can choose to do while she's standing up, or we can do while she's laying down. It's the same, okay? Our MLF1, same cannula of 10 centimeter and 18 gauge. I go always from the same entry point. I clean always the area. Slide massage. When she is in a standing position, it's a bit more tricky because there is the weight of the tissues on the cannula. So now I am on the superficial fat tissue, and very, very quickly and nicely I inject a bit of filler with the retrograde technique. Tell me if you feel anything, please. Try to resist, you're doing very well. I'm releasing a bit of fibrotic tissue and I can feel under my cannula. Remember, we are using a cannula, so if we have to change the direction, we have to go almost completely out. And that's it, done. So we finish our injection, we clean completely the area, we put a nice plaster here. Look the difference, patient is happy, front, you good? She's a strong patient, she's perfect. Stay like this. So I prefer to remove the black mark because it's staining the skin, and I go with the normal white pencil, the one we use usually also on the face. I just did the same marking. I will mark again my entry point from here. So from this point, I will reach all the area I have to fill, always avoiding to go too close to the upper and the lower edge. Are you ready? You can lay down, please. So here we are again on the right side. I will start always disinfecting with my lovely chlorhexidine. Again, make sure, sorry if I do that, make sure that the thigh is relaxed, there is no contraction of the muscle. And I do my local anesthesia. This is the same syringe I used before. 0.2 was the injection. I'm doing the injection of the anesthesia, okay? 1, 2, 3, zick. Always suction test to be sure we didn't take any vein, and injection very slowly because it burns a bit. We create our nice superficial bubble. You can see here. Okay. Thank you very much. And we go with our needle perpendicular to create the entry point. 1, 2, 3. She has a strong skin. It's done. Okay. We can start the injection. Same principle, we go on the deep fat layer. So from here, I use the left hand here. A good surgeon should know how to use both hands. Credit to me. Okay, pain. We are here, 10 centimeter. I start doing my injection, always retrograde, because we want to create the first scaffold. Are you okay? Tell me if you feel anything. We change our direction. We go more on the hips area. Sorry. It's normal sometimes to find some fibrotic septum which makes your life miserable. There we go. When we fight with fibrotic septum, automatically there will be a bit of blood coming out. It's normal. And now we start focusing on the middle of the depression. I touch where I injected the filler. I go a bit more lateral. Stretching the skin can help you to stay on the same plane, on the same layer. Okay, did you feel any pain? Good. Me neither. Just a bit, because I went a bit superficial. It's fine. Okay, the second is done as well. Always clean the area. This is the third one, because my plan is always to stay in between the 4 or the 5 syringes. I'm doing a small massage and I ask the patient to stand up again. This syringe here, as I said before, there is an asymmetry between the two sides. This part was deeper and I can see that the patient needs a bit more in this area. So we are getting closer to our entry point. Again, we don't feel this groove here because it's part of the bone area. We don't touch it. I check the patient also from the side. Here I stay a bit more posterior. I don't go too much in the front, and I check from the front as well. And yes, I see that the depression is in this part. Okay, so this will be my main injection point. Okay, fourth syringe. We did again the drawings while she was standing up. I go always on the deep fat layer, and this time, because I have a single area to lift, I pinch the skin, I reach my point, I press with my finger, I feel the filler coming out, I re-pinch the skin and I inject a small bolus, like 3-4 ml. The bolus should be massaged after that in order to avoid any granuloma or any complication like biofilm formation. We ask the patient to stand up again. So we did the fourth syringe while she was laying down. As you can see, the back side now it's filled completely. She needs still a bit on the front part. And like we did for the other side, we are going to use the MLF1. Yes, thank you, give me the pen. We're going to use the MLF1, focusing a bit in this part in order to fill and give the volume here, and then on the whole area in order to give an improvement of the skin. I do the last syringe if the patient allows me while she's standing up. Can I do that? Okay. 1, 2, 3. When you inject in the standing position, try to be as much fast as possible so the patient doesn't feel anything. I'm seeing exactly how this part is filled now. It's already almost gone. Okay, done. Now I fade the filler all over the area. Are you okay? A bit more just forward here. And then we go, to improve the area of the skin here. You good? So we said she has an asymmetry, so we need a bit more on one side. We are still below the 14 syringes. This one is the 11th. We do some bolus on the middle of the trochanteric region. I marked the area before. The patient, she is a very good patient. I pinch my area. Remember when I said do not struggle, it's an area that might need 2 sessions. I can feel already that the skin doesn't have more elasticity. So for me, this one, anyway is the result, is my last syringe, because I see that there is no more room. She can come back after 3 weeks. We see how the result it is. The filler in the meantime grows by 10% because being hyaluronic acid, it's recalling water. I do a massage of the area, which is a bit annoying, I know. I'm trying to be gentle. I clean my marking. I check the front of the patient. I believe it's fine. I want to focus on something. If you see the patient turning slowly, you still see this small depression here. Now, can you please squeeze your muscles? This area is an area, relax, thank you, where is a retaining ligament creating this dimple. Moreover, we did the injection from this area, traumatizing the area and making this one a bit swollen. What I say always when I do my training, do not struggle with this dimple here. After 3 weeks, it's almost disappear and you will be able to feel a bit more in order to make it smooth and round. We put the plaster.
Perfect.
Almost. Well, compare, you see, also same dimple here. This is anatomical. We cannot release this retaining ligament immediately. We need time. That's why we did also the injection of the MLF1 all over the area, because the skin will get more collagen, more elasticity, and then we will have more room to put more filler. Give me the plaster, please. We put the plaster with a bit of fusidine on the top, so we avoid any kind of infection. I usually do not prescribe antibiotics unless I'm injecting a huge amount of filler like the whole 14 syringes, but still, you can give a prescription of azithromycin, 500 milligrams, 1 tabs per day per 3 days. What I'm going to do now, first of all, I let the patient enjoy the new shape in front of the mirror. We take the picture and we compare the before and after. Always take the picture in a standing position and without shoes. Don't be smart taking picture of the after when the patient is laying down. We know all how to use Photoshop. Don't be smart, huh? So she will enjoy the before and after. We will take the picture and then I will do a taping just below the area of the injection in order to keep this part up and reduce the swelling to go down to the legs. So as I said, we put the plaster to reduce the swelling. Okay, one side and the other one as well. Below the entry point, a slight pressure and we go up. Okay, and we give indication to the patient. So 10-12 days, no gym, no exercise, no horse riding, no cycling, no squeezing, no slapping. Avoid any kind of trauma in the area because it might be painful. For the first 3, 4, 5 days, it might be swollen, it might be a bit annoying, a bit discomfort, and you might have bruises. My advice is you can take some arnica pills, which is a natural anti-inflammatory, or even the Panadol. And if it's red and hot, you can put some ice pack, okay? If you have to fly, like you said, I suggest to use a compressing leggings, a compressing garment, which is suggested to be used at least for 2-3 days after the procedure. You came already with the nice leggings, you can wear the black one, the blue one you used to go to the gym. Follow-up usually is 3 weeks after the injection, and you will see the patient will see a better result in the next 2-3 weeks because the filler will recall water and will give more roundness to the area. Okay? For any problem, I'm here for you.
Thank you very much, doctor.